ASPR begins planning for large special events like the inauguration months and months in advance, sometimes a year in advance.
Welcome to the final coordination call for the 58th presidential inauguration. As many of you know, this is the largest event we support. There are over 600 personnel from HHS supporting this event.
That's 5 MLKs going on there.
Inaugural period, 19th to 21st. 250,000 people expected in here.
We approach each presidential inauguration with an extreme amount of planning and preparation. It's a lot of people in an enclosed space, and they're probably very energized. But like political conventions, State of the Union addresses, or the Independence Day celebrations on the National Mall, we're there to provide public health and medical support for what we think will happen, and are ready for a lot of those things that used to be unthinkable. It's a very large and very coordinated effort.
The NSSE requires federal support. HHS provides the public health and medical side of that support. We do this by working with our federal, state, and local partners to include the U.S. Secret Service, FEMA, state and local public health, state and local emergency management, local fire departments, and emergency medical services. Just from HHS, you have the Assistant Secretary for Preparedness and Response, the Food and Drug Administration, the Centers for Disease Control, and the U.S. Public Health Service.
We prepare and maintain the medical equipment that the Health and Medical Task Force need in the field during national special security events or a national disaster. We push it out to the site and then support and supply any resupply that's necessary during the event.
We're trying to set up all of our trauma supplies in an easy-to-use fashion so that everybody can access it quickly at a time of need.
So we can have them hanging on poles like we usually do in a hospital and everything.
We have various capabilities here. In one room we have a trauma bay. In another room we have a pediatric bay. We have an OB area, and then we have multiple medical surgical areas that we can help anybody that comes into our trailer today.
As the event gets closer and closer, we begin to engage those individuals who will actually be doing the operational command and control of the event.
The teams that we're coordinating, it's a combination of Veterans Affairs, National Disaster Medical System. These are doctors, nurses, paramedics that are from your community that we bring into a federal status to help us support response. Some of the other ones are public health service officers, doctors, nurses, and we bring them together and we form teams. And so the IRCT helps to make sure that those teams know where to go, know what we're asking them to do, and when they're supposed to be doing it.
We're providing support to our federal partners and to the District of Columbia. The main focus is that steady state medical care out in the grounds of the Capitol, the Mall, and Parade Route, and they prepare to respond to and provide support if there is a shooting, there's a stampede, whatever that may be. We're there to provide that support.
While all of our teams that are providing support during the event then can change gears and help support the response to an event that generates casualties, we have additional teams staged around the area that can help augment those teams. And then we can keep on, there's a tiered response. We can keep on bringing in additional people as required.